Hi, and welcome back to the Midlife Momentum podcast. Today, I have a very special guest with me. Her name is Dr. Victoria Mondloch. She's a retired physician with over 35 years of experience, specializing in women's health, family medicine, and preventative health and wellness. Her approach was to educate and empower her patients to better understand their bodies and maintain healthy lifestyle habits. She specialized particularly in bioidentical hormone counseling for women and for men. And she's won several awards, including the VIP Woman of the Year by the National Association of Professional Women and Medical Director of the Year in 2020 by the International Association of Top Professionals, as well as the Most Empowered Female Physician in 2022 and Lifetime Achievement in 2023. So Victoria is also the author of two books, Blossoming, which is a daughter-mother guide for the transition into womanhood, and Full Bloom, which is the owner's manual for making perimenopause, menopause, and postmenopause the best years of your life. And that's basically why we're here and why you're probably listening to this podcast. So thanks for being here today on the podcast, Victoria. I'm so excited to have you here.
Oh, well, thank you for the opportunity. My pleasure.
Yeah. So I think we'll start with the books. In particular, obviously my audience is midlife. We're looking at Full Bloom. We're in Full Bloom at the moment. Can you explain a little bit about what's the book is about, but why also you wrote it?
Well, I actually had my own journey as to why I wrote it. Being obviously a female and an OBGYN, I was doing traditional OBGYN, delivering babies, doing surgery, doing 1,000 miles an hour with my hair on fire for 16 years, became the president of my 8 physician OBGYN group. But I wanted wellness because as we age out of those reproductive years, we're looking for our optimal health and how we can achieve it. Well, hormone loss is one of those things we cannot control, no matter how much we do yoga or exercise or eat right. It's still going to happen to all of us, and it affects each woman differently. So my personal experience was I woke up one morning and my face was on fire. I could feel the heat out to here, and I couldn't open my eyes. So I literally stumbled my way to the bathroom and I had to force my eyelids open and I screamed because my face was beet red, like somebody took a red magic marker and colored my skin, and swollen. I looked like I had had alcohol the night before when I didn't. And I just looked a mess. And I had to be in the operating room for 4 hours. And so you're going to have to wear a mask on your face and not touch your face or be able to put ice or anything else on it. So I'm icing before I go to the OR, and I'm just doing everything just to function, right? And I have no idea why this is happening to me. So after I get to the office and I'm talking to one of my best friends who is also the office manager, I'm telling her this story, and I said, I don't know what's happening with my body. And she crossed her arms and she sat back and she said, well, doc, if you don't know, how do you expect your patients to know? And it was like, boom, she's
Yeah.
right. Oh my gosh, this is hormone swing. And it's hormone swing affecting me at my most vulnerable point, my rosacea. And for
Mhm.
those that don't know what rosacea is, it is more blood supply per square inch to your face, which raises the temperature of your skin. Well, what does hormone shift and hormone change cause? Vasodilation, hot flash, whew, and
Mhm.
then vasoconstriction. Well, that wreaks havoc on your face when you have extra blood supply per square inch anyway. So that's why rosacea, as my weak point, flared the way it flared. And I thought, I have to control this. I can't look like a zombie one day and a drunk the next, and then normal in between. This is not acceptable in a professional situation. So
Yeah.
I literally started checking not only my hormones after I got my skin calmed down with an esthetician. But I thought, I am not the only one. This is just my weak spot. Everybody else has their weak spot. And it's going to hit them like a ton of bricks, even though they changed nothing. How unfair is that? Well, fair or unfair, we need to get to the bottom of this. We need a way for women to be able to be educated and empowered about how do I approach this for me and for my sister and for my kids that are adolescents and my mother who's now menopausal and going through issues. What do we as women have as a resource? And there was nothing.
Mm.
There was nothing. So I thought, all right, give them a resource. So that's part of why I actually went out on my own. I wanted wellness. I wanted to be able to figure this out for women. And my other partners, despite me being the president of the organization, all told me I was crazy. Doing
Okay.
that, wellness is fluff. And I said, excuse me? We've gotten all of these women through their reproductive years, delivered their babies, did D&Cs, did surgeries for them when they needed it. Why are we abandoning them simply because they enter a new phase of life? This is the phase of life we should continue to grow with them because we need to care for them then too. Oh, no, 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 they can get that elsewhere. That's just fluff. We don't need that.
Mm.
I quit. I was the president of the
Wow.
organization and I quit. And
Mm.
I got home and I said to my husband, he said, "You're home early." I said, "Yeah, I quit my job." He said, "You what?"
Oh, oh boy.
I said, "I'll figure it out. I've got a plan. I'll figure it out." So I literally took 6 months off and go into private practice, worked for myself, and started doing the hormone balancing and doing consented research on my patients. And that's how I developed the information that is in the books that I wrote, because I'm giving women the benefit of what all of my patients, 20 years of following them, what those numbers told us where the hormone levels and graphs of those hormone levels should be for your age, not
Mm.
just for you're not in menopause or you're in menopause. It's where should you be in your adolescence? What should it look like in your 20s, in your 30s, in your 40s? What is the disinformation we've been given about hormone and menopausal years? Because we've been given disinformation. So I wanted a way to be able to, put science back into women's health. There is no
Mhm.
science. And if we could reach out and do a poll to your listeners and ask how many have had their female male hormone levels tested by blood work, I would bet it's less than 10%, even
Mm.
less than that. Most women go, huh? No, I've never had that checked. And why is that? That's our moxie. That's what makes us who we are. And how can I explain to somebody why they have pre-period migraines and really heavy irregular bleeding, but this woman doesn't? Well, wait a minute. All medicine has done is cover it up with birth control pills, or said when it gets bad enough, we'll do surgery. Well, no, no, no. That's not the expectation that a patient has. They want to know why. And I
Yeah.
want them to be the incessant 2-year-old. Why? Why do I have this? Because I was the incessant 2-year-old as the doc in training. Why does this happen to this person, not this person? There has to be science behind that answer, or it doesn't make sense. Then we're just assuming that medication is the answer. Well, that's the pharmaceutical way, but that's not what most people want. We want to understand how our body works. And that's why I'm doing the work that I'm doing, is to help women be educated and then empowered to take charge of their own health.
Wow. That's amazing. I love that you quit your job. based on that, because I think, yeah, that kind of response is maybe all too common, right? I don't think there's a lot of doctors out there educated in menopause. So it's, yeah, that's amazing that you did that. That's amazing that you took it into your own hands to be able to see people and gather your own data about this. And that took a lot of courage, I'm sure, and a lot of, like you said, moxie. I think that was really bold, but really amazing, because you've produced a work that you can share with everybody about that. So I'm curious though, because you said like a few things, like getting tested, your hormone levels getting tested, because frequently what I hear is, well, you can get a blood test, but we don't know, I think it would have to be done several times over time to see what the pattern is. Is that the kind of thing that you would do to see what somebody's pattern is in terms of their hormones, frequent blood tests, or how does that work?
I usually, especially in a colder climate, like I'm from Wisconsin, so we have literally 4 seasons. Sometimes we joke and say 3, but we literally have our activity level and how we eat is based upon our climate and our weather, because you're not necessarily going to go out and walk 4 miles every day when it's the dead of winter and you've got icy, slushy snow on the ground and it's a safety hazard if you'd fall. So we amend our activity based upon what our weather is. In warmer climes, that's a more predictable exercise and eating pattern that people have. So having said that, I check levels about every 3 months because that activity level is going to vary what your hormone levels are doing. We are a reflection in our blood work based upon our lifestyle and our activity. So most of my work is based on every 3 month blood levels. And I say blood levels specifically. Others may say, oh, you can do it with salivary testing. Oh, you can do it with urine testing. But my answer back is, when you compare the research of the American research and the European, everything in the world of research is done with blood testing.
Yeah.
My second answer back is, do you have saliva in your central nervous system? Why would you trust a salivary level to tell you how your brain is working? Do you have saliva in your knee? Do you have saliva in the muscles of your calf? In other words, you have saliva in your mouth. Yes, it goes down through your GI tract, but that's not a reflection of what is happening in other parts of your body. So the only thing we know that gets to every part of our body is blood.
Yes.
So therefore blood work. So
Okay.
testing, right. So testing those blood levels in, and then when I test them, and again, I came up with the graphs of where we should be, then it begs the next question. Are you, and this is what we all hear and how our test results are reported to us on our phone or on our computer with my chart, is, are you in range? Well, I want to
Hmm.
change that statement. And I want to say, are you age appropriate? Because you may be a 45-year-old woman, but you have hormone levels that are appropriate for a 70-year-old woman.
Mm.
Whoa,
Yeah.
wrong, wrong, but it's in range. Because when they do a reference range, they will many times do it from age 12 to age 90.
Yeah. Wow.
Whoa,
Yeah. A little variable.
just a
Mm.
smidge of a variable there. Some enlightened labs, mostly pushed by the world of infertility, will say hormone levels, especially female hormone levels based on time of cycle, and whether you are premenopause or postmenopause. But that still doesn't go far enough. Premenopause is 12 to 50. So as a 45-year-old, what if you got the levels of a 12-year-old? Would you be happy with that? Maybe not. What if you're 30 and you got the levels of a 48-year-old?
Mm.
Wait a minute. So there are norms that we need to know about that are age appropriate. And
Okay.
that's the key. Same with men with male hormone. That reference range is a broad catch-all. It's like throwing out a net and bringing in whatever comes up. I'm saying, no, I'm dealing with you specifically and where you want to be with what your symptoms are and where do you reach optimal hormone level that is age appropriate for you.
Okay. I love that. And so when you say hormone levels, what hormones are you talking about? Is it just estrogen, progesterone, or are there others?
Women have 4 gender hormones, 2 female, 2 male.
Mm-hmm.
And the really, really, really fascinating thing, men have the 2 male, is that women are never told that there may be a genetic condition while they're in their menstrual years that may make them more male some months and more appropriately female other months. And that condition is a genetic condition called polycystic ovary. But they're never
Mm-hmm.
told that their male hormone may be higher than their female hormone and what they could do about it. They're simply told, we can put you on medication to cover that up. Oh, and
Yes.
by the way, when you're ready, then you'll need to see the infertility specialist because you're going to have trouble getting pregnant. Well, wait a minute. What's wrong with knowing we have this condition? It's genetic, so we can't change the genetics, but we can work with it and manage it. Why not manage it so when we're ready to start our family, we understand what the issues are, we understand where our norms are, so we don't need the infertility specialist right away. Those are $10,000 and $12,000 cycles from the get-go.
Yeah.
Whoa, wait a minute. And many insurance plans or states will not cover that type of expense. So that is a completely out-of-pocket expense. Well, I'm not prepared for that. Who is? Who
Yeah.
is? By the same token, women are also never told that once they hit menopause, they also become more male-like.
Mm-hmm.
What? What? Our female drops off, but our male continues.
Yes.
Ah,
Mm.
and that male hormone gives us increased mid-abdominal belly fat. Ah,
Yep.
is that where that comes from? Worse yet, some of that estrone belly fat converts to estradiol, and you say, well, that's a good thing. That's a good thing. That's female hormone,
Mm-hmm.
right?
Mm-hmm.
Well, there's no balance with progesterone. So we become male and estrogen dominant, which means increased risk of breast cancer because there's no progesterone to counterbalance the estradiol coming from our belly fat. And
Yeah.
that's not even our fault. But nobody tells us to expect this.
No.
So you have no warning. You're doing your same exercise, you're eating the same. So now you cut back and you exercise more, but it doesn't matter because you still have more male than female. And now you're imbalanced estradiol progesterone. And in 15 to 20 years, you'll be one of those women that, oh, you have a bad mammogram. Well, menopausal breast cancer is really easy to handle. We just do the surgery of a couple rounds of radiation and chemo, and it'll never come back. Well, wait a minute. I don't want to go there. Whether it's
Mm-hmm.
easy to take care of or not, you should have told me this is why this happened because I don't want to end up there in 20 years. Never tell us that. So that is all about the disinformation and the
Mm-hmm.
lack of information that we are given. And again, the lack of science in women's health.
Yeah.
We are not second-class health citizens. We need to know how our body works. And so if they won't teach this in medical school, then I will educate you. I will empower you so that you can actually take care of your own health, and you may actually educate your doctor along the way.
Wow. I think that's so important because, yeah, we need somebody like you who can help us advocate for ourselves and give us the information we need to be able to advocate for ourselves because most of our doctors don't know don't have this information, which is very sad in itself, but that is the situation we have to deal with. So I appreciate what you said. You were talking about estrogen dominance. And so, what can we do about that situation where we are in estrogen dominance?
Knowing is the first step. So you
Yeah.
have to know where your blood levels are. Now, the first half of every cycle, a woman isn't estrogen dominant. So we have to rely on the progesterone that we make from ovulation to period, which is about 2 weeks' time. That progesterone and the amount of progesterone that we make has to cover us for the first 2 weeks when we only make our estradiol. That's what makes our lining in our uterus. So we are, by definition, estrogen dominant 2 weeks out of 4, but it relies upon the progesterone we make to counter that estradiol. Okay, so that's just normal physiology right there. Okay. But as we mature through our menstrual career, many times what happens is stress. Who has stress, right? Thyroid issues, prediabetes happen, and sometimes genetically polycystic ovary happens. Well, those are all conditions where you actually may have so much stress put on your female hormones. The progesterone is the one that takes the hit. So you will continually make estradiol, but you may skip periods or have irregular periods. And your progesterone level, the one that stabilizes your lining before you actually drop that progesterone and have a period, that's the culprit is we don't have the appropriate progesterone for our estradiol. And in a
Mhm.
normal graph, what that looks like is this. So your estradiol on a 28-day cycle is the solid line. You make your estradiol all the time, but the dashed line, your progesterone, you make with ovulation, and it's the peak of how high this goes and how fast and how sharp the slope of the drop is here. That
Yes.
tells your body have a period now. Well, what if you only do this? Then
Mm.
you're reaching this right here, and your body goes, do I bleed now? I don't know. What do you think? I think we should. I don't think so. So you go
Yeah.
spot, spot, spot. Or you may be so stressed that you don't make any, and you
Mm.
keep making that lining, which has to come out somehow. So
Yeah.
what if you spend 2 months or 3 months not making the progesterone, and you've got 2 to 3 months of lining that has to come out? Do you think it all comes out at once like a landslide? Sometimes.
Hmm.
Might the top layer come off first, then the second layer, then the third layer? They're different aged linings. They're not all the same health of lining. So there's going to be cracks in that lining, and it's going to cause irregular slough.
Mm.
Oh, so most irregular bleeding is estrogen dominant. So
Okay.
how do you prove that? You do blood
Mm.
tests.
Mm.
So putting the science into what's going on with you. Women with migraines pre-period are almost always low progesterone and out of balance. So again, there are many estrogen dominant syndromes, diagnoses. Endometriosis is one of the major ones. Uterine fibroids, which are benign tumors, are another one. Um, Obviously, heavy bleeding and polyps, which you can develop with heavy bleeding, and those cracks that develop, that you don't slough everything. Those are all estrogen dominant syndromes. Know that if you're estrogen dominant, you can hyperstimulate your breast, your uterus, your ovaries, and those are all putting you at increased risk down the road for breast cancer.
Mm. Okay.
Now take issues that medicine uses on a regular basis, like contraception. We send our teenage daughters off to college. Well, what is the most common contraceptive on every college campus in this country? The shot, okay?
Mm.
A Depo-Provera shot. Now, in the fine print of Depo-Provera, which most college students don't care, they don't want to look at it. They're simply told, we'll give you a shot every 3 months. You won't get your period. You don't have to worry about it. You're in college. You need to spend time studying and enjoying college life. So they love it. But they're never told that the fine print says you have an increased risk of infertility and increased risk of breast cancer.
Wow.
What?
Mm.
What? Where is the informed consent that says I informed these college students that this is their risk? Don't you think that ties in with we're seeing breast cancer in 20-year-olds? We're seeing the age of screening mammogram come down to start at 40 instead of 50?
Hmm.
What is happening? Well, do you think there could be a correlation?
Yeah. And is it also, I mean, from what I know of estrogen dominance, it's also very lifestyle related, which I
It,
assume that our lifestyle habits are in North America aren't very conducive to health, and they're actually promoting estrogen dominance.
they are, and many times it is the diet that we eat, the chemicals that we put into our body are actually very toxic for very sensitive organs like our ovaries. So
Hmm.
not only does it impact that hormone group, but we have three other hormone groups that are the foundation of our health that also get impacted. So I want you to put this thought in your head for a minute. Think of a chair with four legs, and those four legs of that chair are your hormone groups. What happens if one of those legs is broken? You're in
Mm.
estrogen dominance. You sit on that chair, what happens? Boom, you're on the floor. You don't even know how you got there. And
No.
those are the symptoms you're having that are different than somebody else. So you dutifully go to the doctor and you say, well, what's wrong? Well, they run their bevy of blood tests and they go, everything looks great. There's nothing wrong. Get out of my office. Well, you rewrite your chair and you sit back on your chair with a broken leg. And guess what? Boom, you're back on the floor. Well, you didn't get any satisfactory answer from your doctor. So are you going to go back? Maybe, maybe not. But
Hmm.
how are you going to fix that broken leg? You know, falling and rewriting it, that's the definition of insanity. You keep doing the same thing and you expect a different result.
Yes.
So, and what happens if that broken leg now stresses the other three legs and you break the second leg, the third leg, the fourth leg? And now you don't even have a chair to sit on. You're on the floor. Those are the people that would walk into my office and say, I don't feel good. You're the 18th doctor I've seen and nobody can help me. And I'd say, I can help you. I'm going to ask you a few questions. I'm going to ask you to fill out my symptoms, what you have going on. You tell me what's going on. I have a sheet here. Let's go through it together. And out of 40 to 45 symptoms, some would mark all of them. Some would take like mid-abdominal weight gain and 3 times and circle it so hard the paper would tear. And I'd say, okay, give me your top three. So they'd give me their top three, and I'd say, okay, here's what I'm going to do. We're going to check your hormone levels. And if I get rid of your top three in the next 6 to 9 months, are you okay with that? Number one,
Mhm.
I heard them. Not only
Yeah.
did I hear them, number two, I listened to them. Number three, I'm asking their permission to be a partner with them in their healthcare.
Mm. Mm. Yeah.
Wow.
So
That is
different.
powerful, right? Because now there's buy-in. You've gone all these other places and nobody's listened or heard you. So now you're being listened, heard, and asked permission to work with you as a partner.
Yeah. Yeah. Well, I'm a
Isn't
coach, and that's very much the coaching approach. That's exactly what we're taught. So, I
Mhm.
guess doctors need to go through coaching training.
I agree.
So you mentioned those four legs of the chair. What are the four legs of the
I'm
chair? What are those
so
hormone
glad you
groups?
asked. So
Yeah.
your female, male, in guys, your male hormone. So that's your estradiol, progesterone, total and free testosterone. You have to do both testosterones. The total is your reserve. That's like your bank account, all the money you have. Do you go to the bank every time you go to the grocery store and pull everything out of the bank? Go to the grocery store, buy your groceries, and then go back to the bank and put it all back in? Well, no, highly inefficient. So what we pull out of the bank is our bioavailable free testosterone. So we have to know we have enough in the bank account, but we have to know what we're using. And are we
Mm.
overdrawing the bank account at the expense of having something bioavailable to work with? Or do we
Okay.
have too much of both? So you
Mm.
have to do all four. And in guys, again, you have to do those too. Okay. Um, the second leg of the chair, your thyroid, that gland in your neck that is your metabolism. And it's not just a TSH. That's
Hmm.
your pituitary talking to your thyroid to say, hey, are you awake? What are you doing today? You know, so the thyroid itself makes two major proteins that are bioavailable to your body. You need to know, therefore, not just your TSH, but your free T4 that supports the gland tissue of your thyroid. You need to know the free T3, which converts the free T4 to the bioactive free T3 that goes out to your muscles and your joints and the rest of your body. That's how your brain knows you have enough energy. That's how your muscles are told, yes, you can do this activity. You've got enough there. We can do this. And then you need to know whether or not your immune system is attacking either one of those
Hmm.
of free T3, free T4. Now,
Yes.
there are many people that don't understand that your immune system can attack your thyroid proteins simply because of the wheat supply in this country. And
Mm.
they're told they may have a wheat sensitivity or a gluten sensitivity, when in reality, what they are likely reacting to is not the wheat itself, it is the DEET, the DEET
Hmm.
pesticide that agriculture used for decades in the US, and that DEET got incorporated into the DNA of the wheat seed.
Mm.
So we're reacting to the DEET, not the wheat. Those same patients can go elsewhere out of country, Europe, eat wheat, no GI inflammation, no skin rash, no gluten sensitivity. They come back to the States, eat US wheat, boom, everything is flared back up again.
Mm.
So it's important that people understand why, because now that DEET is banned, glyphosate or Roundup and other pesticides are
Yes.
simply following in their footsteps. So
Yeah.
how long will it take before people have glyphosate poisoning? And we incorporate glyphosate, which is Roundup, into the DNA of wheat. We already have that example. Why are we going to let history repeat itself? So
Yeah.
you have to know if A, you have that sensitivity and those antibodies, because one antibody will attack the T4, that free T4, your gland, and it may enlarge and it may get lumps because your immune
Mm.
system attacks your thyroid. Well, think of a fort, and a fort under attack back in medieval days. That's where you put your soldiers, was to repel the attack. Well, that's the lump.
Okay.
Ah, okay. So lumps usually mean, uh-oh, autoimmune disease. So do the testing to find out. And the second antibody is whether it attacks what is going out to your body, your muscles, your joints. So what if your joint pain is really your immune system attacking your own joints because of DEET from your wheat seed, and it's going after your free T3 that goes to your muscles, or goes to your
Okay.
skin and you get a skin rash, or keep going, you
Yeah.
get another
There's so
organ.
many. Yeah. So
Right,
this is something you test for as well.
correct. That's the
Yeah.
second leg of your chair.
Yeah. Yeah.
Third leg
So,
of your chair is your stress. Well, who's got stress,
yeah.
right? And stress can be physical stress, emotional stress,
Hmm.
religious stress, financial stress. There's any number of stressors in our day that, yes, you can take measures like deep breathing, which is hugely helpful. You can certainly screen before you go to bed so that you have a better environment to go to bed with. There are many facets of decreasing physical stress around you, but it doesn't change our internal stress, what we put upon ourselves. So how can you manage that cortisol, which is your stress hormone? And I'm going to say, I only need to know your AM cortisol and your vitamin B12.
Hmm.
Why? Because B12 is how you help control some of that and manage that cortisol. But not any old B12, methyl B12. Why methyl? Because methyl is a detoxification process that we all need to clear toxin out of our tissues. Okay. So think of exercising, and you exercise until you feel the burn, right? Well, what if you never clear the burn?
Mm.
Then you build on that burn over and over and over again, because you may not be able to clear that burn. So I'm not using that as the only example, but think of other examples of, the diagnosis many people are given of fibromyalgia is actually not a muscular issue. It is a poor detoxification of muscles issue. What?
Okay. Hmm.
So people can actually get rid of the level of muscular discomfort that they've experienced for years, sometimes decades. Because fibromyalgia patients are told there's no cure. Well, that's because nobody's drilling deep enough to find out the root cause, which may simply be they cannot methylate properly. 30% of the population missing one or two of the 4 genes that we check for methylation, called MTHFR. MTH is methyl tetrahydro. The FR is folate reductase. So MTHFR, if you write it out, looks like mother,
Yeah.
but
Yes.
30% of the population is missing one or two of those genes, which means they cannot properly clear toxin from their tissues. Well, how do I know? Well, it's a blood test. But if you don't want to do the blood test, can you just take methyl vitamin B complex that has methylfolate, methyl B12, and you've just treated yourself, whether you're missing one or two of the genes or not?
Wow.
Wow.
Okay. Okay.
And you support your cortisol level all at the
Mm.
same time. Easy, right? Oh my gosh.
Sounds easy.
Yes, and you can get that right off Amazon or from your local health food store, vitamin
Yeah.
shop, but make sure it's methyl.
Methyl.
Methyl B12 is not in a B12 shot. That's
Okay.
over $200 a shot if they use methyl. So trust me, that's not what they're using. So you
Okay.
need to supplement orally. It's much more cost effective orally, but always take it in the morning because it gives you energy. So you don't
Okay.
want that at bedtime. Makes sense,
Interesting.
right?
Yes. Yes, we want to stay awake.
What is that
Ah.
fourth leg of the chair? Your insulin.
Mhm.
Notice I didn't say blood sugar.
Yes.
The hormone is insulin. So again, I'm going to challenge your listening audience. When was the last time somebody checked your insulin level?
Mm. Hmm.
Hmm,
Yeah, you're right. We check our blood sugar or our A1C. Yeah.
right. But
Yeah.
think about the fact that that follows the mantra of Western medicine, which is wait until there's a problem, and then I have a pill to fix it.
Hmm.
Wait a minute. No, 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 no. I want to know before I get there. I want to prevent diabetes. I want to prevent insulin resistance. I want to know if I'm heading there because that's the balance of the four legs of my chair. I don't want to feel bad for years and not be told I'm heading toward diabetes. And then all of a sudden, one day when everything's been, your blood work is fine. Oh, by the way, you're now diabetic. What? You didn't
Yeah.
just suddenly flip a switch overnight and become diabetic. That took time. So why isn't anybody manning the store? Why isn't anybody checking for the risk factors? Where's your insulin level? And how is that impacting your dietary choices and your exercise choices? What if you knew 10 years before that you were already rising your insulin level and you were becoming insulin resistant? So you could turn that back. And then you're not waking up one day and you're told you're diabetic. You've headed it off at the path because you know.
Okay. Hmm. And blood sugar, you can't, it's not the same pattern.
It's too acute of a marker.
Okay.
In other words, let me give you the perfect example. Most people don't realize that if you fast more than 12 hours, we all think that we're going to burn fat, right? If you have a choice to burn, muscle or burn fat, if we wait long enough and we fast hard enough, we will burn fat.
Mm.
Mm-mm. What happens is your body goes, oh my God, the boss, your brain, the boss needs sugar. The boss needs to work. They just woke up in the morning. They have to get ready for work. They've got to function. The boss needs sugar. Well, you're fasting. You're not eating anything. So what does your body do? Like in any good body, it goes out for the fastest source of where do I get sugar? So it
Hmm.
goes to your muscle.
Yeah, your protein. Yeah.
It breaks down the glycogen stores in
Hmm.
your muscle because it only takes 4 kilocalories of energy to do that. Boom, boom, boom. Quick energy, quick shot. It's like taking a shot of sugar water. Boom. Your blood sugar does this, even though you haven't eaten a thing. What? So only when you exhaust the glycogen stores, and I'm simply showing you one set of muscles. You've
Yeah.
got muscles all over the place, right? So
Hmm.
you do this on a regular basis and you eat one meal a day and you spend the rest of that 23 hours a day that you're breaking down the very muscle you go to the gym to build. That's called a do loop. That's called insanity. You're doing the same thing, expecting a different result.
Yep.
You have to get to the point where you now burn fat. The only way you will burn fat is if you have no more glycogen stores left. Or, or if you target a muscle group, burn out the glycogen deliberately so that now you sculpt that part of your body
Mm.
by burning fat.
Mm.
Wow, can you do that? Yes, that is the principle that every exercise physiologist knows and practices called super slow strength training. It's what all the professional teams use as they train their athletes is you want to sculpt a body maintain muscle, but you want to burn the fat. You want the cream of the crop left. Okay. So can the everyday person do it? Yes. It's a technique where in 2 to 2.5 minutes, you keep your muscles under constant load. And at the end of that constant load, you are burning out all of your glycogen store and your muscle will fail. And you'll be lifting that weight and all of a sudden it'll go clunk because you have nothing left. The muscle failed you. Well, failure is success because a failed muscle means you burned all the glycogen off. Now you're burning fat there. Go to your abs. Do the same thing with your abs. 2.5 minutes. You burn off the glycogen. Now you burn fat. You can do 6 exercises in a half an hour and burn fat in 6 areas of your body, very targeted, very sculpting for your body shape. And you raise your metabolism because now you have more muscle than fat.
Interesting.
Whoa, right? So light bulb moment, right? Is yes, walking is important, physical activity is important, gets our circulation going. But if you truly want to sculpt your body and you truly want to quickly burn fat, that's how you do it.
Okay.
So
That's good
again,
to know.
right, if you fast, so I would see patients all the time and they would come in and their blood sugar fasting would be 115. And I'd say, wait a minute. Did you eat this morning? No, doc. All I had was water, really. Okay, you got drawn. It says you got drawn at 8:30. When did you have dinner? Oh, I had it at 5 o'clock the night before. Well, that's more than 12 hours. So guess what?
So, yeah.
By 12 hours, 5 o'clock in the morning, their body started breaking glycogen down and their blood sugar reflected that. So
Okay.
a Western doc will see that and go, oh my gosh, you're diabetic. You're pre-diabetic. I've got to send you to the dietitian. You've got to take classes. We're going to start you on this medication called metformin. And all of a sudden, you're pigeonholed into something that it's not even correct. It's because they didn't go to the root cause and ask enough questions. So you might be wrongfully labeled diabetic, type 2 diabetes, pre-diabetes, because nobody actually checked, was it a 12-hour fast or more? And what is your
they don't
insulin
ask.
level? They don't ask. Don't
No,
ask, don't tell,
no, that's it. Yeah. Wow, that's all amazing information. I really appreciate you sharing that. So those are the 4 legs of the chair. And so if we get back to, I guess, what we can do in terms of, I know we were talking about estrogen dominance. What can we do if we find ourselves in that situation? I guess we would look at these legs of our chair first of all. What about, and I get asked about hormone replacement or hormone therapy and bioidentical hormones and all of that. Is that something you also subscribe to?
I do, because menopausal women need to know that they cannot make progesterone on their own. You can eat a truckload of yams, which is what natural progesterone is manufactured from, but you cannot eat enough. How many truckloads of progesterone or yams do you have to eat in order to have that much progesterone production? So whether it's topical, whether it's ingested, you need bioidentical progesterone, and it needs to get to a level that balances with your estradiol level. So it begs the question in menopause, what is the proper estradiol level that we have to, number one, absorb calcium? What? I need estradiol to absorb calcium from my gut? Yes, you do. And if you don't have a level of 30, you cannot absorb calcium. You can take it, feel really good about I took my calcium supplement today, but then why did I fall and break my hip? Because your level was likely less than 30 and you took it, but you never absorbed it, you passed it. So do yourself a favor and know what your level is. But your estradiol level of 30, the range is 30 to 50. So in that range, you calculate your percentile, or your doctor calculates your percentile. So 30 is first percentile, but you're at least in range. 40 is halfway there, so that's 50th percentile. 50 is 100th percentile. So know where you are. But then if you make no progesterone, then you have in percentiles 100 with 50, or what, to 0% for progesterone. So you're estrogen dominant.
Mm-hmm.
So you have to put progesterone back in, whether you do it again, topical or oral. It has to be human-based bioidentical progesterone. Are estradiol and progesterone covered by your insurance? Can you pick it up at CVS or Walgreens? Yes. Yes. And that's the blood testing for it is covered by your insurance. Holy smokes. Really? So again, in progesterone, I need that progesterone to be 2 to 1 over your estradiol to prevent hyperstimulation. So that's what's going to keep you safe. That's why I could have 80-year-olds on hormone replacement and they felt 45. They acted 45. I had an 85-year-old who had a riding lawnmower topple over on her because she was on a hill. And she called afterwards and she said, "Oh, Doc, I got to tell you, yeah, that was a dog. I had to come out. My riding lawnmower landed on me. I was pinned underneath my riding lawnmower." And I'm like, "Oh my God, are you okay?" "Oh yeah, I wiggled out and I had to push my riding lawnmower back and I got back on and finished the lawn." Now, how many 85-year-olds are you going to hear that didn't break a bone, had 0 stress fractures, and just, righted their riding lawnmower and kept going? Not
Yeah.
many. So
So the key is the progesterone to balance the estradiol, whatever
you
that level
must,
is, which you have to test.
right? You must.
Right.
So,
You
so if
must.
you don't, you will make your own estradiol from your body fat.
Yeah.
You,
Yeah.
even if all you do is say, "Okay, I'm not on board with the estradiol, not yet." Um, I'll tell you, my 70-year-olds would come in and they'd need implants because they were pulling so much calcium out of their teeth and their bones that's where it showed up first. I had a woman who walked in. She said, "Doc, I'm as healthy as a horse. I'm here because I'm losing all of my teeth. I have to have every tooth in my mouth pulled and have implants. It's going to cost me $40,000. Why did that happen to me?" I said, "You're not on hormone, are you?" And she said, "Oh, no." I said, "That's why that happened to you.
Yeah.
That's where it's pulling it from. Your body needs the calcium." And well, I
Yeah.
took the calcium. I took it every day. I said, "Yeah, but you didn't absorb it."
So when and this is interesting because usually when you hear hormone replacement therapy, it's estrogen that they're giving you.
But that's
A lot
wrong.
of
It's out of balance.
Yeah,
It's going to
that's
give
where
you,
where my confusion is
right.
should we be taking the estrogen, but then they would need to check our estradiol levels before they go there, I'd assume.
Yes, absolutely.
Yes.
You said
Yeah.
it perfectly. And then you need to know you have to counter that with enough progesterone, or you're handing yourself an abnormal mammogram and either breast
Yes.
cancer, uterine cancer, or ovarian cancer down the road. You're giving it to you.
Okay. So you need to have both.
You do.
Chances are, if you need the estrogen, you also need the progesterone, most likely. And or if you're estrogen dominant, you could take progesterone on its own or the bioidentical estrogen on progesterone on its own.
Right, right. So it's
Okay.
all about, what are your numbers? What is your body telling you?
Yeah. Yeah.
That's why
Okay. So
just
that's
get
really
them.
important that these are specific things we need to ask for in terms of what are our levels in terms of estrogen,
Right.
estradiol in
Right. Your
particular,
body
right?
is different than my body, which is different
Yeah,
than somebody else's body. So we shouldn't have a one fix fits all. That
that's
that
it.
doesn't work. And that's what they're throwing at it. And the
Mm,
disinformation we've been fed is only the American research on hormone replacement, which didn't look at human-based bioidentical hormone at all. Well, wait a minute.
mm,
That's the information that says increase in breast cancer, increase in heart attack, increase in stroke. Well, at the same time, we did Women's Health Initiative with no human-based bioidentical hormones studied. The Europeans did their study and they did it with human-based bioidentical hormone. Wow, they came up with opposite results. They came up with, no, we see a decrease in breast cancer, decrease in heart attack, decrease in stroke, decrease in osteoporosis. Oh, and by the way, we see a decrease in this.
In Alzheimer's. Yeah.
What?
So
What?
what is I know we're pretty much at the end of our time, but I really want to understand from you what the difference is between bioidentical hormones and what we're being given generally.
The Americans are usually being given what was studied in WHI, which is Premarin, which is
Hmm.
pregnant mare's urine. What? Horse pee?
Yes,
Yep.
my mother was on that. Yes.
Yep. And Prem Pro, which is Premarin with a synthetic medroxyprogesterone acetate. Guess what? The same thing that was in the shot, which
Mm,
promotes breast cancer.
wow.
What? No, no. But many women are only given Premarin. So there's
Yes,
no progesterone
there's
there.
no progesterone in it.
You
Yeah.
have to understand you can't cut your body in half and just treat with one hormone and leave the other, unattended. You can't do that. For
Okay.
women, we need both of our female hormones, but they have to be balanced.
That's it. And they have to be balanced, like you said, the rest of our lives. This isn't like here, I'm in Canada, but it's very similar here to the US. But it's 10 years you can be on hormones or age 60. So not
Mhm.
beyond.
Based on
That's,
WHI, based
yes,
on the Premarin studies. Okay.
that's it.
Now, the European studies did, as I said, the human-based bioidentical, and it's just a question of time before their recommendations come out to say you can go beyond 60, you can go to 70, you can go to 80. But that's what my research in my books shows is I had 80-year-olds on hormone replacement. And quick story, an 81-year-old went and got her mammogram, and I get the call from the radiologist. We need to do the compression view, the ultrasound. Oh my gosh, this is an abnormal mammogram, and we have to proceed to biopsy. And I said, absolutely not. And she went,
Mm,
what? I said, you will not put a needle in her breast. This is an 81-year-old on hormone. What? You've got an 81-year-old on hormone? Are you out of your mind? I said, you are looking at a mammogram and seeing the age, 81, but you're seeing the breast of a 50-year-old. And that's what scares you. And I said, this woman is balanced on hormone. If you tell her you're going to go all the way to biopsy because it could be cancer, you're going to brand her with a C right here. And she will never get rid of that brand. It will always be that I might have cancer. I might have cancer. I might have cancer. And I said,
mhm,
you deal with her for 5 minutes. I take care of her for the rest of her life. I said, I refuse to let you do that. I will let you do an ultrasound. I will let you do a compression view. But if you have to go to biopsy, you will call me first. And there was silence on the other end of the line. And the woman said, wow, you really do care about your patients, don't you? I said, well,
mm,
shouldn't we all? Isn't that the whole point? It's not the protocol of how many biopsies I can do and okay, this finding and okay, now we're going to do it's another one, set them up for a biopsy. It's no, you don't understand the psychological damage you do to that patient by putting that
mm.
C right there. We
Yeah.
have to respect that. So
Yeah.
I'm giving women the tools to empower themselves, educate yourself. It's something that we all can benefit from because we're all of the same tribe. We're all women. We don't
Yeah.
ask for menopause to happen, it just happens. But we have to learn how to gracefully work with it.
Yes. And yeah, I really appreciate what you've shared here today because I think you have given women a lot of tools that they can now go and ask for and advocate for themselves, which is so important. I know they can also go out and get your books. But before we go there,
Mhm.
there's a question I ask all my guests before they go. And it's, what is the best part for you of getting older?
That I still feel 45 years young.
Oh,
And
I
people
like it.
look at me and say, "You aren't almost 70." Yes, I am. But
Wow.
you wouldn't know that by watching how I move when I exercise, by watching how much I eat when I eat, by just looking at the I still have collagen in my cheekbones. In other words, I don't represent the typical almost 70-year-old female. I represent youthful aging.
Yes, I love it. I love it. Thank you so much. And so now you can share, like, if my audience wants to know more about you or your books, can you tell us how they can get in touch with you or find the books?
Absolutely. Well, my website is the easiest. It's drvictoriajmonloch.com. So the HTTPS, no decimal points or periods or whatever, but Dr. Victoria J, my middle initial, Monloch.com.
Yeah, and I'll
On
share that
my
in the show
website,
notes. They can
yep,
click on the link.
yep. On my website are the book's flyer. So the adolescent book, the mother-daughter guide, and Full Bloom, the actual perimenopause, menopause, postmenopause book. This is our book, ladies.
Yes, yes, that's our book. That's our
That's our
book.
book.
So I think
Mhm.
that would be wonderful if we could all go out. I checked in Canada, it's on Amazon.ca, so which is great. So I know it's available here. And because most of my audience, not all of my audience, but many women in my audience are from Canada. So you
Mhm.
can definitely get Full Bloom here in Canada as well. So that's great. And I just want to thank you so much for being on the podcast today, Victoria. It was a real education. I really appreciate the things that you shared. Very different from what a lot of us are hearing, and I really appreciate your wisdom on this.
Thank you. And know that the last chapter in the book is how to talk to your healthcare provider.
Ah, wonderful. Wonderful. And
Mhm.
you've also shared a resource as well, a freebie, which I'll make available in my show notes as well, right? Do you want to
Correct.
just
And
quickly
that's
show us
the
that?
symptoms that you can quickly go through before you go into the doctor. This is that checklist that I talked about that people would mark and check and circle so hard they tear the paper.
Yes, the hormone symptom checklist.
Right.
Yes,
Because you can do this ahead of time, hand it to your doctor, and now you haven't forgotten a thing, and they're on notice.
wonderful. That's wonderful. Good. So I'll make that available for everybody. You can download that and bring it to your doctor and already have it filled
Mhm.
out and know exactly what you need, or they'll be able
Exactly.
to help you with it.
Hmm.
Yeah. Good. Well, thanks so much, Victoria, for being here today, and we'll definitely keep in touch.
My pleasure. Have a great day. Mhm.
Bye-bye. So